Good morning, everyone. We are Group 4, and today we will be presenting about important and meaningful topic Buddhist practices for health and well-being in palliative care. In this presentation, we'll explore how Buddhist practices contribute to reducing suffering, promoting peace, and enhancing overall well-being of individuals who are in palliative care. We'll also discuss how Buddhist teachings provide emotional strength, acceptance, and sense of inner peace for those who are facing the end of life. So we are altogether 6 members in our group: Sarmila, Niru, Manisha, Catherine, Kavindi, and me, Karuna. And today I am going to present about Introduction to Buddhism, its key belief, and core concept of Buddhism. So first, let's talk about Introduction to Buddhism. So Buddhism is a spiritual tradition founded by Siddhartha Gautama, also known as Buddha, in 5th century BC. It is the fourth largest religion in the world, as there are more than 500 million followers worldwide. Buddhism has historically been most prominent in East and Southeast Asia, but its influence is growing throughout the West, especially through practices like meditation and mindfulness. Buddhism don't focus on worshipping God, but rather on achieving inner peace, compassion, and enlightenment. It encourages self-awareness, kindness, and balanced way of living. Here I have attached a link to a short introduction video to the Buddhism. So let's talk about key belief of Buddhism. The core belief of Buddhisms are based on Four Noble Truths and Eightfold Path, which guide followers towards wisdom, ethical living, and inner peace. The Four Noble Truths includes dukkha, which means life involves suffering. It believes that pain, loss, and dissatisfactions are part of life. The second is tanha, which means that suffering is caused by desire. It believes that attachment and cravings leads to the suffering. The third is nirvana, which means suffering can end. It believes that by letting go of desire, one can achieve inner peace. And fourth is Eightfold Path, lead to the end of suffering, which is a practical guide to living a balanced, enlightened life. So there are 8 principles which believe that it can lead to wisdom and peace. And the eightfold path are right understanding, right intent, right speech, right action, right livelihood, right effort, right mindfulness, and right concentration. Moving on, core concept of Buddhism. Buddhism teaches that life is ever changing and that true peace comes from understanding and overcoming suffering. The key concept of Buddhism includes dukkha, which means suffering. Life is filled with impermanence and dissatisfaction. Everything changes, and attachment to the things cause suffering. The second is karma. Every action, thought, and intention has consequences. A good action leads to the positive action, whereas bad actions bring suffering in life. The third is samsara, which means reincarnation. Life is a continuous cycle of birth, death, and rebirth. Their karma determines their next existence. The fourth is nirvana, which means enlightenment, the ultimate goal in Buddhism, freedom from suffering and cycle of birth. It is a state of peace, wisdom, and liberation from old desire. This concept guide Buddhists towards self-awareness, ethical living, and inner harmony. Thank you. And in next slide, Manisha will explain about Buddhist perspective in illness, suffering, and medication.
Thank you. Good morning, everyone. My name is Manisha Shrestha. I will be presenting on Buddhist perspective regarding illness, suffering, and use of medication. Understanding cultural and spiritual belief is essential for providing compassionate and effective care, especially for Buddhist patient. Buddhism teaches that suffering is an unavoidable part of life, which is explained in Four Noble Truths. Many Buddhists accept illness as a part of illness and pain as a natural experience rather than resisting them. Karma plays a role in how some Buddhists view health, as they believe their condition result from past action. The concept of impermanence help them cope with pain, as they understand all experiences, including suffering, are temporary. Medication and mindfulness are often used as medication and mindfulness as often used as way to manage pain and emotional distress. When it comes to medication, many Buddhists may have concern about taking strong painkillers such as opioids, because they believe in avoiding intoxication. Right, mindfulness is an essential principle in Buddhism, which means they have to remain fully aware and avoid medication that cause drowsiness or confusion. However, if medication is necessary for reducing suffering, many Buddhists will accept it in moderation. In terms of mental health, some prefer medication as natural way to manage depression and anxiety, while others are open to medical treatment when needed. As healthcare provider, we must respect Buddhist patient belief regarding pain management. Rather than insisting on medication, we should discuss all available options, including alternative therapies. Encouraging mindfulness medication can help them manage pain naturally, providing a peaceful environment and supporting their spiritual practice, such as allowing space for prayers or access to Buddhist monk is important. We can also offer pharmacological pain relief options like acupressure, warm compressors, or aromatherapy. Most importantly, effective communication involves listening with compassion and educating patients about their choices without pressuring them. Thank you. I will hand it over to Sarmila, who will continue. Next slide.
Thank you. Good morning, everyone. I am Sarmila Sapkota, and today I will be talking about wellness and disease prevention in Buddhist lifestyles. Buddhism promotes a holistic approach to health and wellness, focusing on the connection between the mind, body, and spirit. Many Buddhist lifestyle practices support disease prevention and overall well being. One of the most well known practices is meditations and mindfulness, which helps individuals manage stress, anxiety, and chronic pain. Studies have shown that mindfulness based intervention can improve heart health, reduce high blood pressure, and strengthen the immune system. Medication also encourages emotional strength, allowing individuals to accept their health conditions rather than resisting them. Another key aspects of Buddhist wellness is diet and nutrition. Many Buddhists follow a vegetarian or plant-based diet, which is associated with a lower risk of heart disease, high blood pressures, and diabetes. Buddhism also teaches moderation in eating, emphasizing mindful consumptions to prevent overeating and promote digestive health. Additionally, the principle of ahimsa, non-harm, encourages the avoidance of harmful substances such as alcohol, tobacco, and excessive processed food, promoting a healthier lifestyles. Buddhist traditions also incorporate gentle movement practices such as walking, meditation, and yoga, which helps with mobility and flexibility, especially for elderly individuals. These practices not only support physical health but also enhance mental clarity and emotional balance. In this slide, we'll be talking about mindfulness best approach to health. In healthcare, um, like mindfulness based approaches such as MBSR and MBCT, which is mindfulness based stress reduction and mindfulness based cognitive therapy, have been widely used to help patients manage chronic pain, depression, and stress-related illness. These techniques combine Buddhist meditation principle which with modern therapy to support mental and physical well-being. As a personal support worker, it is important to encourage mindfulness and meditation by providing a quiet, comfortable space for relaxation, supporting patients' dietary choices based on Buddhist principles, and offering gentle movement exercise like chair yoga, which can also enhance their well being. Additionally, healthcare providers should educate patients on stress management techniques rooted in mindfulness while respecting their preference for natural healing methods. Valuable community resources for Buddhist patients in mindfulness-based stress reduction programs, often available in hospital and wellness center, which teach meditation technique to manage stress and illness. Local Buddhist centers and meditation group also provide spiritual and emotional support, offering guided meditation and teaching to improve overall well-being. By integrating Buddhist wellness practice into palliative care, healthcare providers can support both the physical and emotional need of Buddhist patient, ensuring a holistic and compassionate approach to care. Now, I would like to hand over to my colleague for the next slide.
Thank you, Sarmila, and hello everyone. I'm Niri. Now let's talk about how Buddhism view hospitalization, surgeries, and blood transfusion. This is important because as a healthcare provider, we need to understand and respect different beliefs in caring for Buddhist patients. Hospitalization, most Buddhists accept hospitalization, especially if it is help relieving suffering. This align with their core belief in ahimsa or non-harm. That means seeking medical help is not just okay; it's actually encouraged if it promotes healing. However, some Buddhists might decline treatment that they feel only prolongs suffering without improving quality of life. Another key aspect is mindfulness. Some Buddhist patients may want to stay away during treatment and might prefer minimal sedation instead of heavy painkiller. They may use meditation, prayer, or chanting to help them stay calm. So, as a healthcare worker, we should support this practice whenever possible. Ethical concern. Buddhists often view illness as a part of karmic cycle, but still seek medical treatment to relieve suffering and improve quality of life. There is a balance between accepting modern medical intervention and exploring natural or alternative healing practices such as medication, acupuncture, or herbal medicines. Surgeries. There are no religious restrictions against surgery in Buddhism. For major surgeries, they may want spiritual preparation such as blessing from a monk or chanting to create a peaceful mindset before going into the operating room. Also, some Buddhists believe that there should be a peaceful, undisturbed process. If surgery has high risks, they may request specific rituals in case they don't wake up. This is something we should be mindful of when caring for Buddhist patients in critical condition. Blood transfusion. Blood transfusions are generally allowed in Buddhism. There is no religious rules against them. However, some individuals might have personal concern about karma and bodily integrity. For example, they may believe that their body should remain as it is, even in medical situations. But in some cases, saving a life takes priority, and Buddhist patients will accept blood transfusion as an act of compassion and wisdom. One important point is informed consent. Buddhism emphasizes personal responsibility. So, Buddhist patients should always be fully informed before making medical decisions. PSW nursing intervention in medical care. So, how can we as caregivers support Buddhist patients in medical setting? Respect patient autonomy. Always allow Buddhist patients to make informed decisions based on their beliefs. Support spiritual practices. If a patient wants sign for meditation, chanting, or prayer before the procedure, we should accommodate that whenever possible. Involving family and spiritual advisors. Many Buddhists consult monk or another spiritual leader before making medical decisions. Consider alternative pain and management. If a patient prefer mindfulness techniques or minimal sedation, we should respect that choice. By understanding and respecting these beliefs, we can create a more compassionate and culturally sensitive healthcare environment. Now, Kavindi will continue with further presentations.
Thank you. I am Kavindi Taruka Lukugalapatti. I will be discussing Buddhist views on organ donation, reincarnation, and rituals around death. This slide highlights Buddhist perspectives on organ donation, reincarnation, and death rituals. Central to Buddhism is the wish to relieve suffering, and organ donation is seen as an act of compassion and generosity, aligning with Buddhist values. It also contributes to medical advancements and saving lives. The slide outlines the types of organ and tissue donations, such as heart, lungs, cornea, and skin. Additionally, Buddhists believe in rebirth and karma, where actions in this life influence future rebirths. This emphasizes the importance of a peaceful death and ethical living. Funeral ceremonies are simple, often involving with white attire and offerings like flowers and incense. Memorial practices honor the departed while acknowledging grief as a natural part of life. Here, this slide highlights the key interventions personal support workers can use to provide compassionate, culturally sensitive, end-of-life care for patients with Buddhist beliefs. The focus is on a holistic care approach, which addresses the patient's physical, emotional, and spiritual well-being, empowering them to make decisions about their care and maintain dignity during their final stages of life. PSWs also provide spiritual and emotional support by respecting Buddhist practices like meditation, chanting, or prayer, helping patients find peace and mental clarity. For pain and symptom management, non-pharmacological approaches such as meditation or breathing exercises are incorporated to alleviate pain and anxiety. Effective communications is essential as PSW facilitate honest conversations about death, helping patients accept impermanence and reduce fear. Family involvement is encouraged to support the patient's spiritual practices and create peaceful environment. PSWs also ensure culturally sensitive by accommodating Buddhist rituals such as chanting, offering incense, or arranging visits from Buddhist monks. Finally, they assist in end-of-life preparation by guiding patients to reflect on Buddhist teachings about impermanence, helping them release attachments and achieve mental clarity and peace. Thank you. My colleague will continue with the next slide.
Patients in palliative care. Lingyan Mountain Temple, Canada, was founded in 1999 through the compassionate version of Venerable Master Miao Lian, with the generous support of benefactors from various communities. Beyond serving as a place of worship, the temple is dedicated to Buddhist education, offering English lectures, youth and children classes, and other programs designed to make Buddhist teachings accessible to people of all ages. Committed to community engagement, LYMT also supports palliative care services and provides prayers for the deceased. One of its key missions is to foster religious and academic exchanges between Eastern and Western traditions, helping to introduce Buddhism to a broader audience. Buddhist Light Spiritual Care Group. With the guidance of Fo Guangshan Temple of Toronto, FGS Toronto, the Buddha's Light Spiritual Care Group was established in late 2020. The group made up of counselors, coordinators, and volunteers who provide spiritual care and support in warm and compassionate environment. Their services are available of volunteers, members, and friends of the Buddha's Light International Association Toronto chapter. BLIA Toronto provides spiritual care to individuals and their families to approach life and death with a positive state of mind. Compassion and wisdom based on the principles of humanistic Buddhism, palliative and hospice care. The group support goal is to bring spiritual and emotional comfort to the clients and their families. The volunteers support palliative and hospice care and serve to provide companionship, respite, and spiritual support. Group support. A series of group support sessions will provide a safe space for those who respond to their loss, to find a way to move forward with their lives and to find meaning in the relationship with their loved ones who pass away. What are the Buddhist approach in palliative care? Buddhist teaching emphasize that doctors should heal with love and compassion above all. They are encouraged to help patients focus on their mindsets rather than just their physical symptoms. This approach can ease both physical and emotional suffering, preventing patients from feeling entirely consumed by their conditions. In Buddhism, the body and mind are seen as interconnected rather than separate. Since nothing exists independently, everything is constantly changing and linked. The idea of impermanence is central to Buddhism teachings and is reflected in the human body itself. It continually changes from birth to death, serving as a reminder of life's ever-changing nature. Addressing death and the impermanence of life is very important in Buddhism philosophy. Death is considered to be ever present and a natural part of existence, rather than being born and dying. Our true nature is that of no birth and no death. The physical event of dying nevertheless present one with the opportunity of preparing and training the mind, usually at the end of life. The body cannot be controlled, whereas it's possible for the mind to remain clear until the end.